Miracle cure or medical myth? Are stem cells the miracle cure that could eliminate arthritis once and for all? Hello, this is Dr. P, Dr. Petropoli, otherwise known as Dr. P. If you have a problem with your knee, call Dr. P. So we hear a lot about quote-unquote stem cells, and that's a very large and controversial topic. But what do people really think of stem cells as, or what are stem cells? Well, people think that stem cells are cells that are in our body that can turn into anything. So they're a cell that hasn't turned into anything yet, and theoretically it could turn into a heart, a lung, a kidney, skin, cartilage, meniscus, ligament. And technically that's true, and that is definitely true and can be done in the lab, where we can take a stem cell and make it differentiate or turn into a lung cell, for instance, or a liver cell. And that is very, very promising. But we are not to the point right now where we can grow back a new liver, lungs, completely grow back cartilage and make a joint completely brand new. We can't grow back a new meniscus cartilage, which is the shock absorber cartilage. So the use of stem cells and the term stem cell is very confusing to people and to patients. Technically, we can't even do quote-unquote stem cell injections in the United States. We're not allowed to take stem cells, which the majority of our stem cells reside in our bone marrow. There are stem cells throughout our whole body, next to our little capillaries, blood vessels, and our fat actually has a lot of those in it. So some people do harvest quote-unquote stem cells from adipose or fatty tissue. But the bone marrow is probably the number one area where our quote-unquote stem cells are. And as we get older, we have less and less of those types of stem cells, or less and less a concentration of those stem cells in our bones, other than our spine and our pelvis. So number one, there's not just stem cells in our bone marrow anyway. There's all kinds of cells in there. There's stem cells, there's cells that help the stem cells, there's red blood cells, there's platelets. There's all kinds of things in our bone marrow. So if we concentrate the bone marrow, that is going to concentrate all those cells, including the stem cells that are in there. But it's not like taking the cells from your bone marrow, sending it to a lab, growing them, culturing them, multiplying them, and then shipping them back and injecting them into someone's knee or someone's liver or someone's heart. We can't do that in the United States. Now, there are trials, research trials out there where things like that are being done, but we are not allowed to culture or multiply cells in a lab on our own and inject them into a patient. However, we can take bone marrow and concentrate it, and that has stem cells and other cells that help the stem cells. It has platelets that have growth factors. It has growth factors. It has anti-inflammatory factors. And we can inject that into areas such as a knee joint, for instance, where there may be arthritis. But it does not, quote unquote, cure arthritis. So that kind of blows that myth away, meaning we cannot grow back all the cartilage in a joint that's been worn down, and we can't really grow back any meniscus cartilage. So there's two types of cartilage in the joint. There's the cartilage on the end of the bone, which looks kind of like the white on the end of a chicken bone. And in a knee, we have our femur, our thigh bone, and our tibia, our shin bone. And there's cartilage on the end of the bone, which is kind of like the tread in a tire. When that wears down, that's what arthritis is. Now, the most common form of arthritis is osteoarthritis. That's where the cartilage on the end of the bone is wearing down just from wear and tear. And genetics do play a part there. Some of us get the Michelins, and some of us get the the retreads. And some people's joints, their cartilage wears down faster than other people. There's a lot of other factors that lead to that as well. But the bottom line is osteoarthritis, or wear and tear arthritis, is the number one form. Now, there are other things that can cause that cartilage to wear down. Someone can get an infection in their knee. That would be terrible, but the infection can basically eat away that cartilage. There can be things like an accident where you get into a car accident, or I hate to say this, but I've seen motorcyclists who've literally, the road basically wore away the cartilage on the end of the bone mechanically because their knee hit the pavement at 80 miles an hour and see you later cartilage. So that is technically a form of arthritis. That's post-traumatic arthritis. So it usually comes from an injury. I mean, certainly war injuries, things like that can cause that type of arthritis. And then there's other types of arthritis such as rheumatoid arthritis, lupus, gout, inflammatory arthritis, that basically what's happening is the body is attacking itself. So in rheumatoid arthritis, for instance, it's an autoimmune disease where the body is attacking itself and your body is attacking your own cartilage and wearing it down. I'm simplifying things quite a bit there, but the problem is the body is attacking itself. So a lot of patients who have rheumatoid arthritis are on rheumatoid medications, and these medications basically are anti-immunologic. Our immune system attacks our joints if we have an autoimmune disease. And so taking medications that inhibit the immune system will help avoid the attacking of that cartilage by our immune system. The problem is it can lead to being more prone to infections and cancers and other things. But some people have no choice. They can't move. They have so much pain. Their joints are just being eaten away because their body's attacking it. So they need to be on these medications. Well, that does impact how we treat these patients and whether or not we can treat them with bone marrow injections or adipose cell injections or things like that. Remember, these are not quote-unquote stem cell injections, but they're biologic procedures. So we're taking cells from your bone marrow, we're concentrating them, and we're injecting them into your knee joint to help remodel, repair, heal that knee joint, and maybe grow some cartilage back, but not necessarily make that knee 100% back to normal again. Over time, we will get to that point, but we're not quite there yet. But we're way farther advanced than where we were, 5 years ago, 10 years ago. That's a biologic procedure. What we're doing is we are taking your cells and they are going to do work. Now, if you have rheumatoid arthritis and you're on an anti-biologic, anti-immunologic medication, that's going to inhibit those cells that we inject in there. And so a lot of times patients who have rheumatoid arthritis or lupus or gout or are on any of those anti-immunologic medications, they're not candidates for the bone marrow cell injections or the adipose cell injections or even PRP, platelet-rich plasma, which are biologic injections. Either they have to come off those medications for a couple weeks before and ideally at least a couple weeks after to allow the cells and the biology to do its job, or they're not a candidate. And so those patients require a lot more discussion and communication with their primary care physician and also their rheumatologist or their specialist who deals with that type of arthritis. So a lot of times we are able to get them off that medication for a couple weeks and still proceed with the biologic injections, but that's not always the case. So I've kind of talked about different types of arthritis. I've talked about the bone marrow injections, whether or not they're really stem cell injections, and they're technically not. So, are quote-unquote stem cells the path to the future and the cure for arthritis? They are not right this exact second, but we are further along than we were before. And I believe in the long run, they will play a significant part in treating and or curing arthritis, although we can't 100% say that right now. And I think there will be other treatments. There'll be other either medications or genetic-based treatments that will even prevent arthritis, especially osteoarthritis. As I alluded to earlier in the video, some people, their genetics, their cartilage wears down faster and they get arthritis faster than other people who have different genetics. So if and when, and we already can in some instances, identify what factors lead to the joint wearing out faster, if we can alter that, that may prevent all this in the long run. Then we won't even need the stem cell injection. So bottom line is, it will play a role. None of this stuff is perfect yet, but it's a lot further advanced than it was when I first started out over 20 years ago. And give it another 5 or 10 years and let's have another conversation. So I hope that answers a lot of your questions about, quote unquote stem cells. Can they cure arthritis? What arthritis is? What the different types of arthritis are? If you want more info on any of this stuff, please comment in the comment section below. Always like us, and please subscribe to our channel so you can watch these educational videos and learn. Thank you.